This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch here on Talk Radio 1210 WPHT every Sunday 8 until 9. It's appointment listening right here
yes.
on the radio. Good to have you with us here on the show as always. And Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And I'm your host, John DeMasi, just along for the ride with Dr. Molly here on Health Watch. If you have a question or if you have a medical challenge that you want to run by Dr. Molly, 855-839-1210, 855-839-1210 is the number here in the studio. At any time during the course of this show, we encourage you to call in and have a question for Dr. Molly. Feel free to do that, 855-839-1210. And as always, Dr. Molly, good to have you with us.
Hey, it's great to be here, John.
And a little bit of a different show today.
Oh, yeah.
And we'll talk about it later, but you're going to focus on Lyme disease later on in the show.
Yes, I am.
Why, is that because you just treat a lot of Lyme patients, or what?
I've, in the course of 27 years, John, I've seen my share of chronic Lyme, and it's a pretty dastardly kind of condition, and I think we'll get into that a little later. But it's one of those conditions or one of those syndromes that, again, affects your quality of life like you can't believe.
That's
so, of
true.
course,
That's
it fits
true.
right into our repertoire.
Yeah, that's right.
Yeah.
There is a new page on Dr. Molly's website, Living with Lyme, and we'll talk to her about that, and we'll have a special guest a little bit later on in the show. But for now, we want to talk about Innovative Medical and how it's different and how it's innovative, should we say.
Yeah. Well, the bottom line, John, is that we're a group of like-minded providers, and every one of them works out of my facility or our facility in Marlton, New Jersey. So it's a primary care facility, so we're able to do anything that a primary care doc can do. If you need an x-ray, if you need an antibiotic, let's say you got bit by a tick and you want to get an antibiotic. Obviously, if you're a patient of ours in terms of our infusion therapies, you're going to be able to do that. But, what really separates us from traditional primary care is that we're interested in your quality of life. And we're interested in that in a way that if you need medication, we're obviously going to put you on medication. And the docs are very good at that. If you need it, you're going to get it. But what we want to do is use the least amount of the medication possible to effectuate the change for you and not give you the side effects, not only from the condition that brought you in, but from the medication itself.
Talk about the importance of, and we talk about this all the time, the initial consultation.
John,
and that's the key.
I cannot tell you how important that is, because at that 20 minutes, which I'm saying with a grain of salt, because I have yet to do a real 20-minute consultation. But in that 20 minutes, I can get a lot of information about what's driving you to have a poor quality of life, what is the underlying challenge, and what maybe are the comorbidities that you've forgotten about that may be contributing to this, and maybe get a list of the medications, etc., that we know are also causing you some trouble, so that the whole recipe that you're going through right now can be tweaked. And I know that delivering the nutraceuticals through IV or through hydration is probably the best way to go for most people.
And you talk about that in the consultation.
Oh, yes.
And how effective is the hydration therapy?
Well, the hydration therapy is extremely effective, and there's a lot of data to prove that. You can go on PubMed and look at intravenous treatments of vitamins and minerals in terms of how much the body is able to absorb. right there, that's a big plus, because we know most times people fail on natural products because they simply can't get to the therapeutic level. The fastest way to do that and to get the absorption you need is not only to make sure that where you're going for your hydration is a medical hydration clinic, but that the use of the particular nutraceuticals are well made, and that they are really made for the particular problem you have, so that the therapeutic level and the constituent that actually does the job is delivered to you in a way that's usually not very harmful by using the hydration, and yet we're able to reach a therapeutic level quicker, which means we can effectuate the change for you in a more timely manner.
How do you get people to be convinced that what you're doing is going to work for them?
Well, I think we go back to the same old story. You know, John, I'm a scientist, so I love data, and we have plenty of it. You know, if you come in with high cholesterol, vascular, I mean, obviously we want to do things. If you come in and you're a cancer patient, what do I look at? I look at your PET scans. I look at your CT scans. And, you know, just this week I had a patient who came in and brought her PET scans. And actually she's a nurse, and she actually volunteers at the clinic in between this because she loves the concept so much, a registered nurse. And I looked at her PET scan and we chatted about it, and she had improvement in every single tumor. And additionally, what happened is she had a little change, a small additional tumor showed up, very small. And she said, "Look at this, Dr. Molly, is this?" She said, this is her quote, "I think I wouldn't have any quality of life. I may not have a life at all if I wasn't following some conventional, and your protocol." And I said, you know, I don't want to take credit for that. It's the man upstairs who's doing it. But I do believe he gives us the tools in the natural substances to help our healing journey.
You know, we're going to talk later on about Lyme and about intense therapy and intense treatment. But what can most people expect? Do they get intense treatment, or do they get
I think we
mild treatment?
Well, no, I think we have to decide, just the way you would with any other kind of condition. We have to sit down, we have to talk to the patient, see what their goals are, see how quickly we can help them reach those goals. It's different for every patient, it's different for every condition. You know, some conditions are rapidly taken care of and others take some time. And then there's a little archaeology that has to be done too, because you may come in for one condition, and guess what? We find by doing some testing that you may have a challenge in another area as well. Now, that could be from the medication you're on, or it could just be a comorbidity that you are unaware of. And believe it or not, I'm finding a lot of that now, because somehow people are not going back to their conventionalists for their follow-ups. And I mean, it's just because people I think people are really upset with the state of medicine right now. So
you recommend continuing with your
my goodness, of course.
primary
Listen,
care.
as I said to you before, look, we're never going to tell you throw out your medication. We're never going to tell you replace your specialist or your physician. What are we going to tell you? We're going to tell you that we can augment what they're doing. And then my philosophy is tell the doc it's all him anyway. I have no problem with that. I have no ego in the game, you know, no pony in the race. What I want to do is make sure that my patients and our patients collectively are getting the best care that they can. Right this week, I'm advocating for another patient who is looking for a specific type of radiation treatment that is only done, that I know of, in a standalone place in New York City. She's a little afraid to go to the radiation that is the radiologist, the interventional radiologist that's associated with her hospital.
So you have specialists all over the country.
Yes, I do. I just got a referral from one of my good friends out of Oregon. So over the weekend. So yes, and of course, and as you know, you've been there. I've had patients fly in from all over and come in from all
Indiana,
over.
California, Ohio.
Florida. I have a gentleman coming in next week from Florida. So you know, I have people, and I have contacts with like-minded providers across the country.
We are coming up on our first break of the morning. The show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. The number here in the studio, 855-839-1210. That's 855-839-1210. We always tell you call early, so we make sure we get your call in. And the same is true today, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We both return with more Health Watch in today's version after these words. We are back here on Health Watch, and as always, when we're on the show, and really the operators are there all the time, the number for Innovative Medical Associates is 856-489-0505. You can call right now and set up that initial consultation with Dr. Molly. It is complimentary, and that's where you really learn a lot about your condition, your problem, your medical challenge. 856-489-0505 is the number. Innovative Medical Associates is the place, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sunday mornings, 8 till 9 here on Talk Radio 1210 WPHT. And Dr. Molly, a little bit of a different spin today on the show.
Sure.
You have a new page on your website called Living with Lyme.
Right.
We're going to talk to Lisa Alberta in a moment.
Yes.
But give us a little background on this.
Well, here's the thing. I'm seeing more and more Lyme disease patients, and it's a very interesting kind of thing because in the real world, meaning the world I do, where we worry about functional medicine, where we worry about quality of life, we all know that these patients had been bitten by a tick, and they generally got the antibiotic that was necessary, somewhere between 10 and 14 days if it was severe. Also, there's a 3-day protocol. So the standard protocols are pretty straightforward. You treat the particular bite with the antibiotic, and that's that. However, it's my experience that Lyme disease actually causes a multitude of comorbidities that are often confused with other conditions that are autoimmune in nature. And what's happened is this multi-system infectious disease syndrome is an abbreviation of MSIDS. Multi-system infectious disease syndrome is a real challenge right now. The good news, even for standard of care, is traditionally there wasn't much we could do with it 5-6 years ago. Now we have molecular testing right up my alley, right? To start looking at the molecular structures or the DNA structures of the comorbidity infectious problem. In other words, whatever the organism is that's causing some of these other problems, we actually have traditional tests that are done by labs that are covered today. Wasn't that way when I first started.
Right.
So it's covered, and it helps us zone in on the biology of the organism that they have. And therefore, we're able to look at that and really help with the immune dysregulation. So we, of course, have developed several protocols that include the hydration for Lyme disease and these comorbidities that mimic many other things. And I would say that Lisa is a good example of what it was like to come into me when she had the Lyme and the biotoxins and lots of challenges with this, with Lyme disease and the comorbidities.
And we're going to bring on right now. Lisa Alberta is with us. And Lisa is a patient of Dr. Molly's and has been for many years.
That's the other thing, John. You don't cure Lyme disease in 5 treatments.
Right. So that's a whole other issue.
Yes.
Okay. But Lisa, good morning and welcome to Health Watch. Good to have you with us.
Hi, Lisa.
Good morning. How are you?
Good.
You want to tell us your story a little bit, Lisa, how you came to Dr. Molly and your journey with Lyme?
Sure. It's interesting because just listening to Dr. Molly, it's head to toe. There's a lot of confusion because you don't quite know what's going on, and none of the doctors are really clear. So I was bit by a tick, but I actually didn't know it.
Right.
I had a small rash, but it didn't look like your traditional target. So I just thought it was like ringworm or something. I didn't know. I put some ointment on it. And then when it went away, I thought that was the end of it. But that was actually just the start of all of the symptoms. It started off with like a sinus infection, which I thought it was, and then one thing led to another. I had migraines. I had extreme fatigue. I would go to my family doctor. I would go to, and I had jaw pain so bad I went to an oral surgeon. It was just really across the board. But I think the fatigue and the migraines were the things that hit me the hardest. So my husband actually found out about Dr. Molly. He was at the vitamin shop one day getting me vitamins and supplements, and the clerk was asking, so, what are you here for? And he said, my wife has Lyme disease. And the first thing they said was, does she know Dr. Molly? We were like, no, who's Dr. Molly? So I came in for my first consultation, and for the first time I felt like I was actually heard. Like, Dr. Molly listened to me. She was not judgmental, where a lot of doctors, they assume that it's all in your head. All of these random symptoms aren't making any sense to anyone. So everyone just tells you it's in your head. It's just stress. You're just getting older. Just deal with it. So it was wonderful to have Dr. Molly actually listen to me, hear me out, get all of my medical history. And then she actually told me, I can't fix you completely, but I'm going to make sure that your quality of life gets back to almost 100%. And that's exactly where I am now.
God bless you, too. And by the way, she's a busy mother. She holds down a full-time job plus. So I think that's a win.
And how many children do you have, Lisa?
I have 4 children, and actually we're in the car on the way to church. So if we happen to lose you, that's why.
That's great, Lisa. That's great. And
so you're busy.
Yeah, absolutely. But it's all good. I mean.
Hello.
Hi. Lisa. Okay. Well, we lost Lisa, but I think the thing that, and if she calls back, the thing she wants to talk about is that they've actually put together a support group for Lyme infected patients. And I think that is a wonderful thing, because there's nothing like having people who share similarities in your story to help you get through it, and also to help you not be so impatient about the solution. By the way, when you have Lyme disease, you heard her. She was bit by the tick, didn't know she had it, so she was carrying it around for quite a while. That's why earlier when I talked about the molecular testing, it's so important to start that kind of thing early in your Lyme journey, so that whoever picks this up, whether you go to a Lyme specialist traditionally or someone like our clinic, our docs, that can look at this and say, okay, this is the way we should be presenting this and help the quality of life.
Now, we should tell folks that Lisa is starting a support group, and she would be here. But
that's right. She must have got knocked off.
Yes.
She's on her way to church, and that's good. So,
cell phones will be perfected someday.
That's true.
But we are waiting for her to call back. Okay. So we'll talk about this support group. Right. What does this involve?
Well, I think I do believe, and listen, I got to be honest, John, you know how I am. I'm so busy in the care and comfort of my patients. I usually put that kind of thing to my staff, and Lisa was kind enough. She has a tremendous background in marketing and in support, and in fitness, so she was able to pull this together with several other people that I use, and this is going to just help people in a way to really make their journey more palatable for them.
Okay, we understand she's back.
Great.
Welcome back, Lisa.
Hey, Lisa. So
hey,
tell
sorry
people,
about that.
That's okay. Tell people exactly what the Lyme support group is going to do and what people need to know.
Sure, absolutely. So what we wanted to do was just create that support group where we have a community for anyone who is going through Lyme disease, because like I said, it's very challenging, because if you do get to the point where you're coming in and you're getting your treatments and you're feeling better and you feel like you've kind of like beat this, then all of a sudden you have a flare-up and you don't understand why. So for me, it was all about knowledge, learning why the flare-ups were coming, how to handle them, and to know that they will come, but that you will overcome them. So I just wanted to be there to make sure that if someone was struggling with the first diagnosis or just trying to figure out how to get through and how to live with it on a daily basis, that we're there for each other and I can help. And as you know, I have a marketing background. I'm not a medical doctor or anything, but I think just being there and supporting each other and walking through this difficult journey, because it's not easy. There's a lot of ups and downs, and it's just nice to know that there's someone in your corner that's been there and can help you walk through it.
And I think that's exactly fits the philosophy of our facility, because, again, most of the people who come to me with this are told it's all in their head. And it's truly in their head, but it's got a real diagnosis for it. And there's all kinds of things running around in our body when we have this. So you're absolutely right. So we really need to help people through this journey, because it is not a quick one. Right, Lisa?
Right. And we should mention that if they want to go on the website, there is an icon right there. It says Living with Lyme. You click on that, and you'll see Lisa's picture. And
Lisa looks pretty darn
yeah,
good.
she does look pretty good.
Her husband's a lucky man.
You never
Her
know.
husband's a lucky man. Come on.
You would never know she had Lyme.
That's right.
But you click on that, and it'll tell you all you need to know about the support group and how you can get involved. And it just will help you get through this difficult journey.
Exactly. Lisa, this is great. Thank you so much. And I think we'll be having you on again, hopefully at a later time, so it's easier for you and your family. God bless.
Absolutely. Thank you. I'm glad to be here.
Thank you, Lisa.
So have a good day. Bye-bye.
Lisa is really a person who you can see who comes to the clinic. They're the kind of people I have who come to the clinic, who have open minds. The thing about Lyme, and she touched on this, the thing about Lyme is that you go through certain periods. In other words, when you have this, you have the initial bite. Okay, you may or may not know you have it. Then it's treated. Hopefully it was treated with the antibiotics. But now what we have to do is, by the time you get to me, we have a three-pronged problem. We have to look at what? We have to look at where your problems are, where you're having most of the challenges, what's going on, and what are the comorbidities associated with that. So first is detox, John, and that includes a set of IVs specifically for the detox. That alone could take 5 weeks, believe it or not.
Yeah, so this is not a
5-week deal, and 15 treatments later you're like a new person. No, you'll have periods of time where you feel infinitely better. But as she said, flare-ups are a problem with Lyme.
Okay, we are coming up on the halfway point of the show. As I always say, time flies when you're having fun. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, the number here in the studio, 855-839-1210. If you have a question for Dr. Molly or a medical challenge, this is the time to call in. We got a couple of open lines, so we can take your call right away, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We both return. More Health Watch after these words. We are back here on Health Watch, and again, the operators are standing by right now at Innovative Medical Associates. And the number, 856-489-0505. I'll give it to you again, 856-489-0505. Give them a call, and really the most important thing is setting up that initial consultation with Dr. Molly, and that's where you really find out how she can help you, or what your conditions are, and so on and so forth. 856-489-0505. And don't forget the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. The number here in the studio, 855-839-1210. Continuing on this, really the subject of the whole show is living with Lyme and how you treat Lyme disease. Talk about the chronic nature of this problem.
It can be very chronic. Lisa was talking about the headaches, but there's a lot of other neurological symptoms like strange sensations, numbness, and tingling in the body. So again, what do you think? You start thinking about other reasons why the patient is having this. And so again, you've got to look at how we personalize the Lyme treatment, but we do know that the treatment has to have the components I was talking about before we went to break, which includes the detox component. So how do we do that? Well, we're using hydration therapy as the vehicle, utilizing certain natural substances, and on occasion we've used pharmaceuticals, maybe not in a full dose way, but in a way to help. For example, you can deliver the antibiotics that are needed for Lyme by IV. That's a traditional medical treatment. So here again, we're going to look at the patient, see what the patient needs. But once we finish the detox, and by the way, your friend and old buddy vitamin C is in the detox. But in addition to that, we may be using some homeopathics as well as some other chelators for the specific problem. Because again, I'm going to say it, and because there's not one substances that cause this multifaceted Lyme disease. When the Lyme tick bites, it has viruses, it has bacteria. And yes, we can test for all that. Thank goodness today we have had more molecular testing, and even that isn't foolproof because sometimes the antibiotics have already dysregulated some of that, and now we just have the biofilm surrounding this, as I spoke about last week. So we got to get through that biofilm, which we use vitamin C to help with, and that's the detox. But what happens after the detox? Well, what do we have to do? We have to improve your own immune system, right?
Yes.
Otherwise, forget about it. Your body has to help us do this. And in order to do that, that's what takes time, because now we have to actually improve the mitochondria of the cell, which is what? The powerhouse of the cell. You heard Lisa talk about fatigue. Well, you can imagine that if your power plant is down, guess what? You're going to feel like heck, right? Yeah. So this has to be done, and that gets done also by certain nutrients, depending on where we are in this process. And here's the other thing, John. We may be creating what? A little inflammation in doing all this. So now we have to look at anti-inflammatories like curcumin. So again, this is a three-pronged type of system. So you may have 5 weeks in detox. You may have 5 weeks in supporting the immune system and getting through the biofilm. You may have 5 weeks in the anti-inflammatory. You may have 10 weeks. We don't know. It depends on when you got in your Lyme journey and where you were, and how do we go beyond what normal protocol says, just surveillance. Well, surveillance is not good enough. We're in a real life situation, and that's what I was saying earlier. Real life problems are what most people who have Lyme have problems with. Lisa, for example, had the kids, right?
Yeah.
How do you, and a husband,
4 kids,
and working, and what do you do? Okay, it wreaks havoc in your life, and so each individual patient has to be taken into consideration and figure out what is the right time to continue on this journey and switch up. And believe me, by the way, these particular invaders are very, very smart, and they hang out for a long time because you are the perfect host for them. So right. There we are.
I'll never forget. You know how certain things stick with you?
Yes.
I'll never forget. You remember Al Alberts?
Yes.
Yes. He has passed on, of course.
Right.
But I never forget that he said to me one time, you know, I've been sick for a couple of years.
Yes.
And he said, I went to doctors, he went to hospitals, He went to everywhere, 2 years.
Undiagnosed, I bet.
Undiagnosed, and he finally found a doctor who diagnosed him with Lyme disease.
Well, here's why. Because Lyme disease, and I'm talking about the MSIDS, the infectious disease syndrome, that can be a great imposter. It looks like so many other problems. It can be confused with MS. Can you imagine? It can be confused by MS. They'll give you a diagnosis like MS.
Yeah.
Okay? So think about that. So in that case, that's why it's so important for the healthcare provider to actually go back in time with the patient or the potential patient and say, when did this start? How long? Did you ever see a tick bite? I'm going to tell you 9 out of 10 times, most of the people who walk through my door say they had that under control 3 years ago. Yeah, okay. And now they're in surveillance, but it is not doing them too much good, John.
Yeah. So this is a kind of a thing where you pretty much have to monitor this all the time.
Ongoing until we relieve the actual issues that are creating the havoc that has weakened the immune system. So we go back to something that you and I talk through for all viruses. We've talked about this ad infinitum, right?
Yeah.
You and I.
Yeah.
What do we need to do? We have to strengthen our own immune system. Once we clear out the invaders, which in and of itself is not an easy task because of the biofilm that I talked about. Just to remove that, get through that to the mitochondria takes time. It takes certain nutraceuticals. It takes certain homeopathics. It may take a subclinical dose of a traditional med. These are the things that I'm always thinking about when the patient, and always running by the physicians, because these are the things that can make the difference between good outcome and just okay outcome.
It's like Lyme is an army. And you're fighting the army.
That's right.
Because,
that's right.
I mean, it's just ongoing.
It can affect every single function. That's the problem. And it can affect the GI tract. It affects the brain. It affects your joints. That's why it's so difficult. So you can imagine, yes, do we have protocols at Innovative to help joint pain? Of course we do. But we also have to get to the underlying reason. Why are you having that joint pain? What's going on? And where are these critters? What is going on? And what is the body fighting? It is unreal.
So you have something to cure clear the joint pain.
Yeah, we have something. Listen,
but there's other things that are involved.
Right.
Here.
For example, we need to look at decreasing the inflammation, right? So we have to look at that. There's another problem. We may have to look at thyroid, because sometimes I've seen especially in the last year or so, we've seen that people with Lyme have had thyroid issues. Okay, so we may have to look at the thyroid, and, we have to look at respiratory. I had a patient who had terrible, what appeared to be asthma. Actually, what was happening is she had a comorbidity of some type of mold or fungus that also contributed, and because her immune system was so weak, that's something that you and I might just walk right through, affected her. So here it is. And it's not just women who have, that's another little misnomer, that people think it's more women who complain about these things. No, I've had several men who've had very, very severe Lyme, like your friend Albert's. I mean, it really impairs their functionality for working and for just living, man. It's just unbelievable. So what can we do? We switch up the IVs. One of the things we might use is what? Alpha lipoic acid. However, I want to make sure that helps with the oxidative stress, especially in the brain. We definitely are going to use glutathione, right, in the detox portion, because why? We have to really look at decreasing the inflammation. We have to look at supporting the liver function, because all of this stuff is causing havoc with your liver. We definitely would be looking at certain B vitamins, and again, there is some new data out saying B12, a methylated B12, is very, very important for Lyme patients. And what else do I have to look at before I give them the B12? I have to make sure that the patient can utilize the B12, has the ability to utilize that particular form of B12. We have to use things like NAC, which is it boosts the immune system while going through this, and it increases the glutathione we give people. So this is a complex IV treatment,
Yeah. So the bottom line is, you can help people.
Yes.
But it's going to take a long time.
It's going to take,
safe to say?
It's depending on when the patient first comes in. Obviously, the earlier, the better. But as Lisa said, she didn't even know she really had Lyme until much later. And that's the problem. And then you have the biologies of the organism that the Lyme bite has left in the body, and that becomes a problem. So it can be quite complicated, John.
So what do you do?
you should be in my chair. I mean, the bottom line is you have to meet the patient where they are. So you've got to get a good history of if they believe they have Lyme disease. And sometimes, let me tell you, most of my patients have done such a good job in going back in time in their own case because they're frustrated. They were told, oh, well, after Lyme, all you need is surveillance. Well, surveillance doesn't improve your quality of life, okay?
Yeah.
It just doesn't. So, they really look back and they say, okay, I've had this since I had the tick bite, or maybe I didn't have a tick bite. But yes, thinking back, I didn't believe it was a tick that would actually give me the Lyme disease. Many times you can't go by that. I don't care. They say deer ticks, whatever. I tell you, I've seen more tick bites in the last year. In fact, because of the warm winter, I've seen more people having had a problem. I just had a patient, you know them, Judy, came in. She was bitten a week ago. Of course, we put her on the antibiotic. She got rebitten by another tick. And of course, she's in the chair because what we're trying to do is get a jump on that detoxification. Right? We have to get a jump on it.
Does it help or does it hurt if you live in the woods? Or
she lives in the woods, so
right.
that, of course.
I know that.
Yeah. I mean, listen, the other thing is, I'm going to show you something that'll blow your mind. It's a shame people can't see it, but I have a new map about where the highest levels of these things are. Lyme disease all over the Northeast is incredible. Look at that. Yeah. It used to only be found in the South. But now, because of the warm weather, we're seeing an increase in this, and we're seeing an increase in the type of symptomatology. So again, you need to say to yourself, all right, what are we looking to help? And in the end, I try to look at system by system with the help of my wonderful physicians. We look at this and we say, all right, what are we doing first? Detoxification. We have to improve we have to go after the organisms that are causing the problem, get rid of the biofilm, and we have to then increase the mitochondria function to improve their quality of life.
We are coming up on our final break of the morning. You still have time to jump in here with a question or a thought for Dr. Molly. 855-839-1210. That's 855-839-1210. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPH.D. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are coming back with more of today's Health Watch after these words. We are back here on Health Watch, and again, operators are standing by right now at Innovative Medical Associates. And just so you'll know, they'll be there well after we leave you at 9 o'clock this morning. So give them a call now or later, whenever, 856-489-0505, 856-489-0505, and of course the website innovativemedicalassociates.com. And we should mention that there's that new page that we've set up, Living with Lyme, and Lisa's contact info is on there, and it's a support group for those of you who have Lyme disease, or you know someone who does. It can help you out as far as getting through this whole thing. Living with Lyme. InnovativeMedicalAssociates.com is the website. Health Watch is the show Sunday mornings, 8 till 9, and again this afternoon from 4 until 5. If you miss it this morning, well, you can catch us this afternoon from 4 until 5, the Health Watch replay. And again, our number here in the studio now, 855-839-1210, 855-839-1210. So, Dr. Molly, if you are living, let's say, in the city.
Yeah.
So you say, well, I don't live in the woods, so I don't think I'm going to get bit by...
No. I have patients. John, most of my patients come from PA, right?
Yes.
Now, isn't that interesting? And you know what? I've had several patients there who live in the city and were bitten by ticks. Here's the issue. Aren't you going to a park? People are walking their dogs, okay, the dog park. I have patients who are in the city. They go to the dog park. Guess what? They find a tick. How many people let their dog sleep in the bed with them and get a tick from their dog who's out playing at dog school or whatever? But the point I'm making is, look, it's everywhere. These ticks are everywhere. And in the summer, of course, I thought this was apropos to bring this to our patients' mindsets today, because I want people to be aware that what happens is, because we are out more, we're enjoying the sunshine, want to be out. We're usually in shorter clothes, meaning shorts or, shorter skirts. We're just out there, bathing suits, who knows? Bottom line is, your first line of defense is to get the tick off of you if you see it. If you don't, and you see something that, you heard Lisa, she thought it was ringworm. If you see something that is a little bit not normal on your body, it's time to really look at that, get some testing done, because again, the antibiotics given in an appropriate time are the first line of defense. May not take care of all the symptoms, but it's the first line of defense. And if we treat aggressively, and again, this is a good example of why I say we don't throw out drugs, right? We don't throw out pharmaceuticals. Antibiotics have a place in this. But it would be interesting if you do see the tick and you take it off gently with the tweezers. Guess what I want you to do? Put it in a little jar, bring it to me, because guess what? We can send the tick out to have a molecular test and see if it has any of these organisms there that we need to be aware of.
So this thing with Lyme, it's hard to treat.
Right.
It's hard to diagnose.
Right.
And it's hard to get rid of.
Exactly right. Because again, look at what we have to do. Detox, right? Go after the particular thing and improve function. So it is a three-pronged problem, and it's unique to each and every patient. And certainly in our facility, that is the philosophy of what we do.
So you can figure that you're going to be in this thing for a while.
Yeah, you're going to be in this maybe for 6 months. It's the way it is. You're going to get improvement. It's not like you have to quit your job or stop taking care of your kids, but you're going to see that you'll get gradual improvement. I wish this was holy water. In this regard, I say to you all the time, it's not holy water. This is clearly not holy water because of the complex nature of the Lyme disease itself. It really does take a little time for us to really get it going. And by the way, if you find the tick, it's been on you for at least 4 hours. That's how long it takes to engorge enough for you to see, because these ticks are really, really tiny.
4 hours.
That's right. There's data.
And they can do a lot of damage in 4 hours.
Oh man, can you imagine how much stuff they're pumping into your body? And this, my friend, is something we're seeing that chronically, like your friend Al Alberts, if he were here today, there are so many more molecular tests we could do, so many more data, so much more data that's been out about what other kinds of natural products can help a patient through this thing and keep the inflammation down. I think he would have been with us longer.
Well, that was 20 years ago.
I know. Well, I was around 20 years ago,
Yeah,
and we didn't have the tools I have now,
Yes,
so
that's
thank
right.
God.
So bottom line, you kind of want to go steady with you.
A little bit in this regard, and I try to make it as palatable as possible, and I think we do a really good job with that, because we want you to leave our clinic and not be so debilitated that you can't go home and live somewhat of your life. What we know is this has to happen in increments, and it does. I wish I could say, hey, you walk in, you walk through the water, guess what? You're cured. Doesn't work like that, John.
Can you tell us about any other patients besides Lisa? I mean, we know about her and the living with Lyme.
I had a gentleman who came in from Center City who had it, and he lived up by the park on 6th and I guess that's Independence Park.
Yes.
He never knew. He walked his dog, and he said, "Oh yeah, I thought I had a tick, but I wasn't sure." He said, "I didn't know that I could bring you the tick." I said, "I wish you had." He found it by checking himself. That's the other thing. You want to check your own body as closely as you can, because the quicker you get in, the quicker we can do the deed here.
So what is the bullseye, though? What is
they're
that?
talking about it looking like a bullseye that you have on a dartboard, but that's what is, quote unquote, the normal reaction. It doesn't mean it happens all the time. You may not have anything like that. You may not have the rash that's usually associated with it. You may not have any of that and still end up with some form of Lyme.
What's the consensus amongst all the patients that you have with Lyme.
They've improved, but it has taken some time, John. It's not an easy fix.
That's the theme we've
That's
had
it.
all show.
That's it. I can't do anything else. But
you better resign yourself to the fact that you're going to be there for a little while.
A little while, but you will have improvement. You will have improvement. I would say you start to have improvement after we do the detox. Even then, you start to have the improvement. The idea is I want that improvement to last. And there it is. You don't, because what Lisa was talking about was the flare-ups. And that comes and goes depending on how we're running after these comorbidities.
And if your doctor says it's in your head,
it could be, but it's definitely a problem. It's not that you're, depressed or anxious or any of that. If you're anxious, it's just a symptom of the challenge. That's the thing.
Well, if you are living with Lyme, as we say, you want to get on the website and check that out. And the support group that Lisa Alberta is spearheading, you want to get involved with that as well. Maybe it's just another way to help you out, courtesy of Innovative Medical Associates. And with that, we put the wraps on another edition of Health Watch. Don't forget, Dr. Molly is available, and you want to call and make that initial consultation. It's complimentary, 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And don't forget, check out that section, Living with Lyme. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Catherine, Lana, and Donna, and of course there's delightful Dee, fabulous Fran, Joanne, our medical assistants, Karen, Kathy, and Sandra. I'm your host, John DeMasi. Thank you for listening. Have yourself a great week and a healthy one. We'll talk to you next Sunday. Health Watch, 8 till 9 here on Talk Radio 1210 WPH.D. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.